Welcome to the Don't Count Me Out podcast. This program is dedicated to stroke survivors, loved ones, and caregivers, medical professionals, and anyone interested in learning more about this devastating disease and the warriors that face it every day. Our mission is to share stroke survivors' stories of inspiration and hope, form friendships and community, gain knowledge and insight, and the courage to dream and explore new avenues as we find our way back to living. So, my friends, the Don't Count Me Out podcast begins right now. I want to introduce you to someone who is going to be able to offer some information, especially if you are doing physical therapy of any type. She's really very interesting, and hopefully this will help you to determine what you need for your own growth. Without saying any more, I'd like to introduce you to Shannon Cobb.
Hey there.
Thank you for being with us.
I'm glad to be here.
Anybody who has the title therapist, whether it's occupational, speech, or physical, you guys are my heroes. You brought me back to life. What got you interested in doing therapy to begin with?
I had a knee injury in high school and had to have knee surgery and then go through physical therapy. Admittedly, as I was in college, I was taking science-based courses, but I didn't know what I was going to do with my life. And I was like, I went through physical therapy and I liked that. And so that might be fun to do. I really, I don't have one of those inspired stories from the very beginning of wanting to be a physical therapist. I ended up getting into physical therapy school on my second try, so I really was committed. Loved physical therapy school, loved the challenge of it. In my mind, when I came out of school, I was going to work with people who were spinal cord injured. But the work and my training during school, where we get to go and work at hospitals as a student, I didn't really get that exposure. What I did get exposure to in school on those rotations, and then as I started working, was general rehab. And where I live in the United States, in South Carolina, there at the time, which is around the year 2000, there was a high incidence of stroke in what's called the Southeast. That was called the stroke belt. And I lived in an area of South Carolina that had an even higher rate of stroke. And so that area was considered the buckle of the stroke belt. So in my work as sort of a new therapist, I got to work with a lot of folks who were stroke survivors. That was awesome, but also for me, discouraging, because I, in hindsight, realized I didn't have enough training to really be able to help. And that's not a good feeling, when you're working one-on-one with a person and their family, and there's that expectation that you're the person who knows how to give some information to move those next steps. So I ended up being exposed to some continuing education that showed me that stroke recovery is very hopeful. There's a lot of opportunity for improvement and change. And so over the course of my career, I've taken over 400 hours in specialty training to help with stroke rehabilitation, and also looked for jobs where I could focus and specialize in helping stroke survivors. I've worked in inpatient rehabilitation. So for folks, that's after you're in the hospital in that emergent situation and you get transferred to a rehab hospital. So I worked in that setting. And then I've worked in an outpatient specialized program for brain injury and what they called young stroke. Young stroke wasn't age-based. It was kind of like how active you were and how engaged in the community you were at the time of your stroke. And so that was really exciting. And that was a team environment where it was really highly integrated with physical therapy, occupational therapy, speech therapy, psychology, and then case management kind of on that insurance end, and neuropsychology. An actual neuropsychologist created the program and ran it. So that was a great learning experience for me as a physical therapist. But I got a little discouraged in that everywhere I've worked was within sort of a hospital, the medical system, right? And what I just feel is that the medical system isn't well set up for stroke survivors, because improvement can go beyond, a few weeks, a few months, and the medical system kind of hasn't caught up on how can we try to maximize, say, benefits for people and what's available for them to help that improvement continue beyond that kind of traditional window that's set by in my opinion, insurance companies. I started working for myself in 2016 and have been doing that kind of ever since. And of course, with the pandemic, everybody went online, right? I was also, I had a business where I was helping stroke survivors, but I had other employees and we were specializing in helping people with Parkinson's disease. We had gone online to do a lot of our exercise programming that we had offered in person. We took it online like a lot of folks did. I kind of thought, you know what, there's something there for stroke survivors. I got exposed to a lot of what's available for people who are living with that diagnosis of Parkinson's disease. And I feel like there's a lot of positive things that are out there for them to be able to access. Those ideas carried over for stroke survivors. So right now I'm seeing one-on-one clients in their homes and just developing some online programming for stroke survivors because I do know there's that gap. When therapy finishes and you're having to do it on your own, kind of what can help you bridge that gap?
Tell us a little bit more about the differences between the different therapies. How do they work together? How would you explain the different types of therapies?
Working in that program really closely with all those varied disciplines helped me understand better about brain rehabilitation, which is really what stroke recovery and improvement is. If we sort of really generalize, we kind of work on the big movements. So focus in physical therapy sessions might be on walking, climbing steps, stooping, bending, kneeling, crawling, reaching, kind of all of those big things. In my opinion, a physical therapist needs to have an understanding about the upper extremity, the hand, and how that works, because it really, we don't function in kind of all those big things as just legs or trunk, like it's a whole person. But that's what we're going to focus on in physical therapy. But I need to be aware of, say, if another therapist, the occupational therapist, who might be focusing more on upper extremity impairments, I need to know as a physical therapist what kind of strategies or tips and cues I should be giving the person I'm working with to reinforce whatever it is they're working on in occupational therapy. Yes, a lot of times people think PT legs, OT arms, right? I don't think that's necessarily the case, but because we're a complex thing, the therapies have to sort of divide and conquer is the way I refer to it. Then occupational therapists work really on what are considered your activities of daily living. In part of that divide and conquer, a lot of times the OTs focus more on how your arm is working, but they also work on kind of some of your thinking skills, like your planning and your organization. Another thing that an occupational therapist who helps stroke survivors is going to have some awareness of, kind of factor into their treatment, is how your vision and your perception of the environment affects what you're doing. And so they might assess and screen for that. They might refer you out then to somebody who's a specialist to help with vision training. They're going to focus on like a little bit of that thinking and planning. I feel like occupational therapy is a little bit of a bridge from physical therapy to speech therapy. Speech therapists, I wish the profession had a little bit of a different name because it kind of doesn't convey the expansive things that they help stroke survivors with. Certainly speech therapists do help with speech, creating communication, voice. Also, speech therapists are going to help with kind of that higher level thinking, communicating, organizing, what they call like executive functions, that kind of higher level stuff where you're managing your checkbook and your bills and all of those things. If a person has trouble, so say a person might have trouble with their attention, right? They don't have great attention. It's hard for them to maintain their attention on a task or a particular activity. As a physical therapist, that is important for me to know, because if in my session we're working on an exercise and I'm going to have them repeat it over time or have them change things up and listen for instructions from me, if they have a problem with their attention that they're working on, I need to understand that and know how I should give instructions or choose activities based on the information that the speech therapist and the occupational therapist give me about kind of that particular issue. I think in general, that's sort of how the three therapies can be siloed, but I think we do all need to be aware of what's going on or what's been assessed and the impairments that other parts of that team are working on so that we can factor it into our treatment sessions and help reinforce whatever they're learning or they should be kind of applying in their life when they're working with us.
Neuroplasticity to me just happens to be a key that has opened so many doors just recently. And and make all of us realize that through repetition and the work that you do, you really get farther with your recovery. But you have to be so dedicated to you. It's one time in life where you can say that it's all about me, because it is.
You're right. I think that's why I really love working with stroke survivors. You know, there was a period of time in not too far past history, because I've been doing this for a long time, that as healthcare providers, we believed that the brain didn't change. After a stroke, whatever you got back, that's what it was. And there wasn't any intervention we could do that could make a change. And so studies kind of throughout the 90s, there was a lot of money invested in studying how the brain works. You know, the realization that even as adults, our brains can change, and they change as a result of experiences and things that we do, opened a lot of people's eyes and doors for opportunities for change after a person has a stroke. And I think we don't even know what we don't know yet with regards to that. So there's still, I think, a lot of potential there. But, you know, we talked about those two other therapies that were part of that program that I was able to work in, which was excellent, that aren't necessarily a part of everyone's stroke recovery just because they're not maybe exposed to a program that has it. But I think that psychology is hugely important. It was really helpful to have a person who was a psychologist as part of the team with the folks we were working with, because this hits you out of the blue as a stroke survivor. There's zero preparation. You don't know anything. It's not, for most people, a familiar setting to be involved in the healthcare system. Like, you're talking about your brain and all of these things that you didn't even realize was happening, can be affected. Wait, there's a part of my brain that just pays attention to stuff, and that can get, injured and not work right. Having a professional who knows how to help you manage maybe some of the emotions and everything else that comes along with it, a psychologist, and who also is who understands what happens with a stroke, what's going on with a stroke, I think was really beneficial for the folks that I worked with. I think finding a psychologist, even if it's not somebody whose stroke specialty, is really, really helpful. And I encourage folks that I work with to at least investigate that and look into doing that. And then, of course, the neuropsychologists, they're the real brainy ones of the bunch when you're on a team like that. But they really do testing to sort of pick apart how your brain's working and where you're having issues to help guide a team like that we were working on, of what the issues are. That information helps people with, say, like return to work, because again, there's not a lot of just sort of basic testing that you're going to find an OT in, say, just a freestanding clinic somewhere, who would know exactly what kind of testing to do to help outline that or what you need to do. And so neuropsychologists, they don't address as much of the emotional part of how your brain's functioning, but sort of the nuts and bolts of your thinking and your planning and all the stuff that goes into that. So again, that's a nice piece of information to have if you're working as a team, to be able to incorporate into treatments, even as a physical therapist. So I learned a lot, because that's not anything you learn about in physical therapy school. I think what is helpful when you first meet somebody as a therapist, in that first meeting, you're always going to talk about, all right, what's your goal for us working together? And generally, folks have a pretty broad and lofty goal. So let's say somebody comes to me and they're only walking a little bit in their home, and they come into the clinic and they have to come in a wheelchair because they're kind of out in the community. But their goal is, I want to be able to walk. Sometimes that's what people will say, right? I want to be able to walk. And then as I talk to them, well, they are walking some in their home. So I have to clarify, like, when you're saying you want to be able to walk, what do you really mean? Like, almost even describe it. I want to be able to walk around my house and pick up my dog and carry her to her crate and put her in her crate. Like just a little bit of an idea of really kind of what your grand plan really looks like, to be more specific. I'll only understand exactly what you need to be able to do if I understand a little bit more about like your home situation and what your dog is like and what kind of things you like to do with the dog. You like to get him in the car, but you have to help his backside into the back end. I don't know. So you start to ask questions on what it's really like. If a person is sort of assessing themselves and that's their big goal, and then also sort of break down what steps you might need to achieve to get to this goal, because that goal is super important and I always factor it in. But as you're going along in that process, in terms of like assessing yourself, if you're going to assess your progress as you've started doing something, what I always recommend is that when you assess, you don't say, all right, here's where I am now. This is how far I am from my big goal, because that can be very discouraging. And it actually is not important. What matters is, here I am now, but this is where I was when I started, or this was my last self-assessment or measurement. How far have I come? What's the little piece that's still hanging me up that I need to focus on to help me move that next bit forward toward that big goal, so that when you assess yourself, the comparison is to where you were, not necessarily where you're going. And the other kind of general big thing that I would say that you could look at, and everybody's a little different in terms of their ability to see maybe this, but kind of more like I did before, or more like everyone else who's moving more typically is moving. And generally for people, it's always about some degree of stretching. Folks come to see me that really is a glossed over piece of the improvement process, that stretching is a piece of what's going on, especially as a physical therapist. A lot of the issues that folks have who come to see me, we start to integrate some degree of stretching that's pretty consistent.
I worked as a peer counselor in a hospital as a volunteer for probably about 9 years. Sometimes you had to be a little more cautious as to what you said to them to encourage them, because in some of the areas of the brain, they have no inhibitions and they'll try anything. And I bring that up because I happen to have been one of those. I had to learn my manners all over again, and that comes under occupational therapy.
Mm-hmm, mm-hmm. In those situations, a lot of times there's two things going on. Somebody might be impulsive. They're moving or speaking before there's been some sort of processing of, is this a good idea? And there also might be like a lack of awareness, like even an awareness that that's a problem. Like that's a part of your brain that can be affected. So as a therapist, again, learning what are the cues and the strategies that the speech therapist and the occupational therapist are teaching this person to help kind of reinforce that a person's going to verbalize what's going to happen before they do it, so that they can be sure they've kind of slowed themselves down and what they're going to do makes sense. So then as a physical therapist, I need to take opportunities when we're working together to have that person verbalize the steps of whatever it is we're going to do. So even if it's the same exercise, for example, that I did with the client I saw before them, I'm going to have them do the same exercise because physically they need that same thing, but I want to be sure that they're getting in the habit of slowing themselves down. And I'm going to give them the instruction that I'm going to say, okay, tell me again, what are the steps that we're going to do? So they have an opportunity to verbalize it back, slow themselves down, and then perform the activity. And also, if a person kind of moves in an impulsive way, that I kind of interrupt that so that they're not practicing always doing things in an impulsive way. And that also that my way of being when I'm with them maybe is slower and I go through things in a step-by-step manner. Two things that I talk to folks about. The first is when I give a home program, I try to only give a handful of things to most people. Some people like a whole boatload of stuff and they'll follow through and they'll be consistent. But I'll give a handful of things. The one thing that we've learned about making a change in your brain is that repetition is the key. To be able to repeat things does take some time. I'll have people do shorter bouts, maybe a morning and an evening bout of thing, where they're doing maybe 2 or 3 exercises, and one of those always ends up being a stretch, and they do it for a period of time. So then they can get a lot of repetition in without counting and working on it that way. That's personally what I feel like helps. Therapy can't just be that window of time where you're working with your therapist and then you go home and nothing's therapeutic. And it also can't just be when you're home, that window of time where you're doing your exercise program that your therapist has given you. It's really helpful if you can kind of start to design your life to be more therapeutic. So just trying to work in habits that make your daily life more therapeutic, I think, is another way to help reinforce your therapy. If you're an impulsive person and you just, move around really quickly and that's not really therapeutic, what are you doing during periods of your day to try to be mindful and move in a way that reinforces whatever you're working on in physical therapy or occupational therapy? So those are the kind of the 2 ways that I go about helping folks design their home program.
And that basically is what it boils down to, is we're all trying to get back to living our lives. How long does it take someone? I know all of us are different and we're in different stages of recovery.
Yeah, the crummy answer that I hate to give, but it's honestly the most truthful answer. It really does depend on the person and their experience, kind of what they're living through too, because it really just isn't about kind of how the stroke affected you. You got a whole bunch of other variables in your life that can hold things up. You might experience a loss, the death of a loved one. That's going to jam you up. But I do think the important thing is that like improvement can occur. It's not that there's some window of opportunity for it either, which sometimes people get told. Like, we don't know what we don't know. So we don't know when that window closes or when the best time to do it. The best time is now, and doing the best that you can with whatever situation that you're in.
How important is sleep to all of this?
I am not an expert on sleep, but I'm learning. I want to learn more. Clearly, rest is huge for all, like just as people. So things that we know, like that we're learning, and sleep is really big right now, just in terms of adult health. There's all kinds of stuff out there about how to get better sleep and studies about sleep and how sleep affects, this disease or that disease. Clearly for us as adults, sleep has an impact on our health. As a person who's trying to make good, big changes in their body, sleep, I think, is definitely huge. Talking to your doctor about ways to improve that, talking to your therapist about ways that you could be comfortable in bed and sleeping, I guess that's an activity of nightly living for OTs to look at. I agree that I think sleep is a definite piece of the puzzle.
Give us a little idea of what you do. I thought your approach to physical therapy is absolutely brilliant. You don't approach both sides of the body in the same way.
I will say the biggest emphasis I put on my one-on-one sessions with folks is sort of focusing on the problem parts, or like what's missing. But I do think exercise is super helpful. So like generally fitness is good for us, again, as adults. Lots of positive aspects to just having fitness be a part of what we do, which generally is not part of the whole program for a stroke survivor kind of as they're coming through. It really is specific therapy working on impairments people have. Fitness can be very beneficial. We just know for adults, there's lots of information out there. It can help with high blood pressure, with diabetes. It can help with sleep for adults. It can help with depression. Exercise gets lots of good chemicals going in the brain that can help with improving depression. But specifically for stroke survivors, and again, there's not a lot of study yet, but what's starting to come out is that exercise also helps release chemicals that help with that neuroplasticity that we were talking about. So that brain change. And one of those has got a big long name. It's called BDNF, brain-derived neurotrophic factor. Exercise helps release that, and that is a brain chemical that helps those connections get made. Another piece that like more studies are coming out on is that if exercise is done, so say like a fitness exercise to get your heart rate and your respiratory rate up, if you do a bout of that before your therapy exercises, so whatever you're doing to work on that impairment, studies have shown that you can improve that motor task if you do that exercise before. So you kind of get those chemicals flowing. There have been some other studies that show that if you work on a repetitive task, right, which is what we said in therapy we're having folks do, that if you do your exercise session after that repetitive task session, it helps cement that into your brain so that when you come back to do that same task later, you would be more successful. The other little piece that we know about our body, a lot of times if we're just talking about physical deficits from a stroke, a lot of times people will be like, okay, my left side's not working. My right side of my brain is where I had my stroke. If my right side's not working well, the left side of my brain is where I had my stroke. And so the fibers sort of cross to run things. That's true, but there's like a little percentage that actually don't cross, that there's a little percentage on the left side of your brain that innervate the left side of your body, and the same for the right side of your brain. There are studies in what they call healthy populations or like orthopedically injured populations sessions where if exercise is done on one side, so we're going to work on, say, our bicep strength on this side, that if I don't do any of that exercise on the opposite side, I still gain a percentage of strength that this one gained. It's called a cross-education effect. I think that there is a piece of moving what's easy, and for a lot of stroke survivors who have one side affected, moving that side that's easy to move actually has a lot of benefit for improvement on that other side, and also just general fitness and feeling a little bit better, because sometimes it's just hard to get moving and do exercise or do anything that can kind of make you feel better. And so finding some ways to work that into stroke survivors' lives, I think is important.
Do you suggest that people exercise every day, or should they do it 2 or 3 times a week?
Personally, I think trying to get 1 or 2, 3 would be great exercise sessions in a week, but like you have a lot going on, like you're trying to do your therapy. So I think doing what makes you feel good is what's going to be beneficial.
I don't journal, but I know a lot of people do. I think it's so important to keep a record of the victories that you've had along the way. Sometimes they seem so minor when you first see them, and as you go along and they continue to improve, you really need to remind yourself of how far you've come for all the hard work you've done.
I totally agree. And finding any way that you can capture that, I think is great. Writing it down is great. Video, if you're into that, sometimes looking back at a video of how you were moving or functioning several months later can be helpful for people. When you run into somebody who you haven't seen for a long time and they make a note of like how different you look, oh, I think that's such like a reward. Jot that down in your journal, because someone who's been removed from you doesn't have your perspective of the small steps that you've made. They're able to see from that where you were to where you are on that day that they see you. So I think, yeah, any way that you can find to do that.
One of the things that seems to be very popular now and is chair yoga.
Mm-hmm.
Tell us a little bit about chair yoga.
I am not a yogi. I think any exercise that you can do is great. I do think it's awesome that there's a lot more information out about doing exercise in sitting. There's a lot of options out there for people who can move around relatively well. But for folks who right now have difficulty moving around well, being able to find ways to engage your body and move in different ways, even if it's in sitting, I think is hugely therapeutic. And so yoga is awesome. You get into positions and postures that you might not normally do in a day. And that is awesome for your brain. It's awesome for your body because you get to move through ranges of motion that maybe you might miss out on that are going to help your regular daily movement. I really love chair yoga for people, although that is not what I teach.
Tell us more about what you do too.
What I've started to put together are kind of short interval training programs that really focus more on getting your heart rate up, getting your respiratory rate up, tap into getting those good brain chemicals going and getting that BDNF flowing around your system and making you feel better. The way that I have put them together are they're short intervals of alternating exercises that you could repeat if you wanted to. And the way that I instruct the exercises are for a person who's had one side affected by their stroke. Today I'll do like a little mini one for you guys. I have them in seated and I also offer them in standing, but we're going to do the seated one today because just like I said, I don't think there is a ton of opportunity for different sitting challenging exercise for stroke survivors. And I like to demonstrate it with one side is really kind of the easy side to move is what you're going to move because there's a benefit and a value to that for folks.
Well, Shannon, I'm really excited that we're going to have that video that you're sharing that to work through it for the next 7 minutes and see how tired we all are.
Okay, this is going to be a 7-minute interval. And what I'm going to do is just talk a little bit about your setup. So first of all, always choose to be safe when you're exercising. I'm going to demonstrate this in sitting. And what I want you to be aware of is if you can, you want to bring yourself out toward the front of the seat. So we want to be active through our middle while we're doing this, so we can get a little bit of work on flexibility and control through that core. Also, I'm going to be demonstrating the intervals with one side affected. So I'm going to say my side with my watch is going to be my more affected side. So I'm going to place that in a position where it can be supported, and I'm going to be sure that my more affected leg is up under me so I can use it. Briefly, we're going to go through the movements that we'll do in this interval. Okay, so I'll also give a version if both arms are moving okay, or if your arms and legs are both moving well enough to do this exercise. So I'll do that briefly. So the first movement, we're going to be working for 20 seconds at a higher intensity, so harder work for this one. If you can go faster and still be in control, try to do that. But the control is the most important. So the burpee, we're going to be reaching up, and we're going to be coming forward and reaching down. So again, I'm going to be nice and tall. I'm going to reach up, and as I come forward, I'm going to stay nice and long through my trunk, and I'm going to reach down. So up and down. Up. I'm not folding over. I'm staying nice and active through my trunk. Okay? If both arms are working well enough for you to do this, you can reach them both up and down. Up and down. So that's the burpee. The next one, we're going to stay nice and tall. This is going to be a 2-minute active recovery. So we're going to do a bicep curl, and we're going to kick a leg, and I'm going to lean back a little bit if I can. Then I'm going to come down, push back, a tricep extension, and lean forward. So again, from the side, I'm going to do a bicep curl. If you can lean back, do that. If leaning back makes your more affected leg want to sneak out, then don't worry about leaning back. So we're going to bicep curl with kicking that knee out. I'm going to lean forward and push back. Again, staying nice and long through my spine. If both arms are working, you could do them both at the same time, and then you could alternate legs if you feel like you could do that with control. The next 20-second interval of intensity is we're going to march. So we're really going to try to get that arm and leg moving. Remember that we're moving the side that's easier. If you feel like you could have all going or both arms and one leg, okay? The next active recovery, we're going to do what's called a good morning, a modified version. So I'm up nice and tall, just going to rest my fingertips on my head. I'm coming forward, I'm going to come back up, I'm going to tip to the side, still staying tall. That good morning, and we'll tip to the other side. So again, with this one, I'm nice and tall, I'm coming forward, and then tipping to the side, staying up nice and tall. So I'll tell my clients like you're between two pieces of glass. So it's a small movement. We're working in control through that middle. Our last higher intensity interval, we're going to be punching across. So again, I'm going to rotate. I'm going to punch across. I'm not going to lock out my elbow, right? And then I'm going to rotate to the opposite side. Okay, so I'm going to go punch, rotate, punch, rotate. Of course, if both arms could do it, you could just alternate. And our last active recovery, we're going to reach a leg out. We're going to reach down with our chest up. We're going to come up, and if we can bend back a little bit, if your back will allow it, that's how you're going to do it. So again, I've got that leg forward, and I'm going to come up. If you could move both legs, you could alternate. And then, of course, if both arms are moving all right, you can reach forward. And again, I'm going to try to get a little bend at the end. Okay, so those are going to be all of our movements. We're going to start now. We're going to do 20 seconds of higher intensity and then a 2-minute active recovery. Really thinking about being tall. I'm going to get my more affected side position. We're going to start with our burpee for 20 seconds in 3, 2, 1. So we're up and down. Good. So we want this to be challenging. So you're going to move quickly as long as you can be in control. Good. 8 more seconds. Up and down. 3, 2, 1. Good. Now we're going to go into our bicep curl and our pushback. So again, I'm going to keep my chest tall as I lean forward. Again, leaning back a little bit if I can with my more affected leg, staying down. If both legs could move through this movement, you can alternate them. So we're going to just keep moving to add some challenge to this if you want to. Just imagine you're pushing through mud, like really thick mud with this arm and pulling back through. So that resistance of yourself. But again, staying nice and tall, keeping moving. So by practicing staying tall like this, it helps with sit to stand and squatting. We want to train our brain and our body that our trunk of our middle, our core, is going to stay nice and tall and engaged when we do things. And that as we lean forward, our feet are ready to accept that weight. Good, so we're going to keep it up. 45 seconds left. This is just an active recovery. You want to keep moving. If ever you want to take a break, you could take your arm out of it, let it hang, shake. You could take a break from moving your leg. This is your 7-minute workout. You can do it how you want to. We got 28 seconds left. Then we're going to go into our fast march. Bring our heart rate back up again. Now, I'm moving at this pace. If you wanted to move slower or faster, you can, but just be sure that you're staying nice and tall and in control. 10 more seconds, then we're going to go into our march. Good. All right, in 3, 2, 1. All right, so this is 20 seconds. You're going to stay up tall and just try to be fast and coordinated. Good. 12 seconds left. Then we're going to go into our good mornings. 5, 4, 3, 2, 1. Good. Now we're into our good mornings. So we're up tall, coming forward, staying tall, and I'm going to side bend. So I'm going to crunch to the side. Forward, crunch into the side. So we're going to be doing this for 2 minutes. So if you're a little stiff and it's troublesome to do this, side bend, just remember as you go through, you get lots of repetitions in these 2 minutes to go a little bit more or to have a little more control. Now, if sitting tall for this long is hard for you, you can just take a break if you want. If holding your hand up here is tiresome for your shoulder, just let your arm rest. You can do your good morning tip. But just remember, we're staying tall and it's like we're side bending in between two pieces of glass. Good. All right, 1 more minute. So loosening up, increasing your control through your middle helps make lots of things easier. Reaching around in the car, scooting around in the booth in a restaurant. Good. Check yourself every once in a while. If you have to reposition your more affected hand, then do that. 30 seconds left. Let's try to get a feel for having control of this movement. Good, staying nice and tall as you come forward. 15 seconds left, and we're going to go into our cross punches. Good. 3, 2, 1, with intensity. So we're going to punch and twist, punch and twist, punch. Good. Keeping it up. Like you mean it, right? Don't lock your elbow out. Good. 10 more seconds. Good. Boom. 5, 4, 3, 2, 1. Good. Now, we're going to reach a leg forward. We're going to be nice and tall. We're going to reach down toward those toes, coming up. And if you can, if your back allows you, arch back a little bit. Good. So we're going to come down and up. And again, if you can alternate your legs and be in control, you could do that. Good. So again, as I reach down, I'm not going to cave over, right? I'm going to be nice and tall come up, try to get a little back bend if I can. Down and up, down and up. And so you may feel a little pull on the back of that hamstring. That's okay. Just gentle. Nothing should be painful, right? This is just about getting, moving, and using the side that's easiest. Good. We've got a minute left. Reach down. If you can take your eyes up, as you reach up, do that. If that makes you feel bad, don't do it. Good. Just trying to work on. And again, if your shoulder's getting tired, take a break. Just lean forward and come back. Leaning forward and coming back. Good. 30 more seconds. And up. Good. And again, when we get up, we're going to try to get a little back bend on that, if you can. Just do what feels comfortable to you. It can feel like a little bit of a challenge, but it should never feel painful. 15 more seconds. Good. Forward. Staying nice and long through my spine. 5 more seconds. 4, 3, 2, 1. All right. That was your 7-minute workout. If you wanted it to go longer, you could just rewind it back to the beginning and repeat it as many times as you feel like.
Shannon, that was really, really interesting, and I'm grateful that you shared the video with us. What do you have coming up in the future?
In the next few weeks, I'm going to be opening up an online course that I'm calling a Walking in Balance Boot Camp. And that's just going to be a 4-week virtual course about some of the main things that I feel like a lot of the folks that I have helped over the years improve their walking and their balance, sort of an overview of those things. And it's going to have recordings and some downloadable PDFs and a weekly call with me, so I can be sure that I'm including information that folks really are interested in and are beneficial to help them. And then I'm going to be offering these fitness videos in some way, shape, or form starting in September. So a way that's easy for folks to access. And so I'm just trying to figure out the particulars of that. And so those will really be based on strength, balance, and kind of cardio fitness videos.
And how can people get in touch with you?
So on the internet, I'm at thrivestroke.com. And then on Facebook, they can find me at ThriveStroke. On that ThriveStroke page, there's a boot camp tab, or you can go to ThriveStroke/boot-camp. And there's a little button there to get on the wait list, kind of on my newsletter. So I'm going to let my newsletter know when it opens. So they go to that page, they can find out.
Well, I've enjoyed having you on here, and you are more than welcome to join us at any time.
Well, this has been a wonderful opportunity. I really appreciate it. It's been fun.
Thank you. Until next time, all of you treasure your health.
You know, there are 3 questions that those of us who have had a stroke are always wanting the answers to. And those questions are, number 1, will I recover? 2, when will I recover? And 3, how much will I recover? Well, you know, we are all different, and our strokes are different. But early in the discussions with the professionals, they always seem to start that discussion with the phrase, well, you know, there are no guarantees. Well, I've come to wonder if that shouldn't be restated, because there is one guarantee. You know, God has made our bodies to heal. But if we sit around and wait for someone else to do it for us and complain, we probably won't recover much at all. We have to get up, get busy, stay active, and the recovery is more up to us than what the professionals say might happen. Now, for reference, my stroke was 3 years ago. I lost my whole left side. My leg, my arm, my hand. Yes, it was miserable. It was hard, and it was discouraging. But there's no use living in the past, so that's all I'm going to say about that. Let's look at the future. So what are the answers to those questions I asked earlier? Will I recover? Well, not if you sit around and complain and don't do anything about it. Our therapy comes to an end at some point. We get discharged, and it's up to us to start doing things. So it's very important that we take charge of our own stroke recovery. How much will I recover? Well, how hard do you want to work? I know that's kind of a simple answer, but it's really true. If you sit around and don't do anything, you're not going to recover much. And when will I recover? Well, that question is different for each of us. It really depends upon the stroke. So is it true that there are no guarantees? Well, yes and no. There is no guarantee as to how much we'll recover, but there is a guarantee that we won't recover much if we don't get involved. Stay active, stay busy, try to get back to doing the things that you love to do. They will be different, slower, and we may need help with things. But we can recover, we can get better, but it does take time. So you can do again some of the things that you did before. But here's one thing, there's nothing to gain by sitting around and complaining. But there's a lot to gain by getting up, staying active, and doing the things that we love to do. Stay active, work hard, focus on what you can do, not on what you can't do. This is your stroke, and this is your recovery.
Just remember, everybody, don't count us out. God bless. Have a great day. Bye-bye.